So let's figure out what's going on with Sophia. So Sophia is a little 7-year-old girl who was referred to ophthalmology after failing a routine eye screen at her pediatrician's office. No pain, maybe just a little bit of redness around the whites of the eye, looked like pink eye, really no big complaints other than it looks a little blurry. On exam, she was actually found to have something called uveitis, anterior uveitis to be specific, which is inflammation between the cornea and the iris. And this was very unexpected because what a lot of people don't realize is that in kids or children, uveitis can be completely silent with minimal to no redness. And sometimes there's no pain, no obvious warning signal. Maybe it might feel a little bit uncomfortable or gritty. So she was actually sent to rheumatology to get evaluated for an underlying autoimmune condition that could be causing the uveitis, like juvenile arthritis. Now, at her first rheumatology visit, she had no joint pain, no stiffness, and all her labs are normal. It would have been really easy just to say, let's just watch and wait. But an important point to remember is that uveitis can come before or precede arthritis in about 3 to 7% of children. So you want to follow these patients closely. And sure enough, a few months later, subtle changes started to appear. Her right knee started to look a little bit full or swollen compared to the left. She had a limp in the morning getting out of bed. It was very subtle, as well as some morning stiffness. And that's when the picture started to get a little bit more clear, is that this is actually juvenile arthritis presenting after uveitis. So even though in about 90% of chronic anterior uveitis cases, they occur about 4 years after the onset of JIA, uveitis can occur before the appearance of arthritis. So this highlights the point of kind of following these children up closely.